So hello, thank you all for joining us today. I am Rachel Sarvey. I'm the Director of Development at Silent Spring. For those of you who don't know, Silent Spring is a leading research institute dedicated to studying the links between the environment and breast cancer. If this is your first Science Cafe, thank you for coming and welcome. Our Science Cafes feature conversations with experts on a variety of topics related to breast cancer and environmental health and are made possible thanks to generous contributions to Silent Spring Institute. Thank you to all of our donors who are here and those who are not for supporting these events and our science. Before we get started with today's program, I want to let you know about our upcoming Science Cafe. It will be on April 2nd, and it will be about creating healthier homes, featuring our exposure scientist, Dr. Robin Dodson, and guest Amanda Reddy, who is the Executive Director of the National Center for Healthy Housing and one of our partners on the project. So mark your calendars and watch your inboxes for more information. So a few details about today's event. Our moderator, Dr. Beth Whelan, will guide the conversation for about 45 minutes, and then we'll open the program to the entire group for questions. Excuse me. The program will be recorded and made public. We invite you to keep your cameras on if you're comfortable doing so. We also request that you please keep yourselves muted. If you have any questions throughout the program, you can send questions to ask a question from the drop-down menu in the chat, and we will hold on to them until the end, and she will ask them. So let's get started. I'm delighted to introduce you to our host and board member, Dr. Beth Whelan. Before joining Silent Spring's Board of Directors, Beth worked at the Centers for Disease Control and Prevention, where she was a senior research epidemiologist at the National Institute for Occupational Safety and Health. We are very fortunate to have Beth on our board and to have her moderate today's Science Cafe. And with that, I will hand things over to Beth.
Great. Thank you so much, Rachel, for that introduction, and welcome to everyone. Today, we're going to hear about the Massachusetts PFAS and Your Health study. We'll hear Silent Spring scientists share their latest findings, their experiences working with communities impacted by contamination, and what we can do to protect ourselves and our communities from these hazardous chemicals now and in the future. No doubt these are trying times, and investment in research on PFAS and other environmental exposures is very uncertain right now. So thank you for being here today, for your engagement and your curiosity in this vital work. So let me start by introducing you to Dr. Laurel Schaider. She is the lead investigator of the Massachusetts PFAS and Your Health study. She's also a senior scientist who's been at Silent Spring since 2009. She leads the Institute's research on exposures to PFAS, or what we sometimes call forever chemicals, from drinking water, food, and consumer products, and what those exposures mean for our health. Before coming to Silent Spring, Laurel was a postdoctoral researcher at the Harvard School of Public Health, where she conducted community-engaged research on heavy metal exposures in mining-impacted areas. She received her PhD in environmental engineering from UC Berkeley. Also with us is Emily Heckel. Emily is a staff scientist at Silent Spring and the study coordinator for the Massachusetts PFAS and Your Health study. Prior to joining Silent Spring, Emily coordinated clinical research studies at Brigham and Women's Hospital and also worked as a research project coordinator at the Harvard T.H. Chan School of Public Health, where she contributed to studies on tobacco policy and the opioid crisis. Emily has an MPH in Global Environmental Sustainability and Health and a certificate in Risk Sciences and Public Policy from Johns Hopkins Bloomberg School of Public Health. Welcome to both of you. It's great to have you both here today. So Laurel, I'm going to start with you. PFAS have been around in things like Teflon pans since the 1950s. Why have we been hearing about these chemicals only in the last few years?
Great. Thanks so much, Beth, and thanks to everyone who's tuned in today. So PFAS stands for per and polyfluoroalkyl substances. This is a class of extremely persistent synthetic chemicals. As you said, they've been a part of our daily lives since the 1950s. In addition to Teflon pans, PFAS are used in Scotchgard treated carpets and Gore-Tex jackets that people have had in their homes for decades. But it's really just been in the past 10 to 15 years when they've gotten so much attention from regulators, scientists, activists, and the media. When we first found PFAS in drinking water on Cape Cod back in 2010, that was around the time I started working at Silent Spring, there was barely any news coverage of these chemicals. And now every day there are dozens of news articles around the world focusing on these forever chemicals. I think one important reason for all of this attention has been the action and advocacy of impacted community members. For people who are interested in PFAS, I recommend seeing the film Dark Waters, which is about a major lawsuit against DuPont and the contamination of a community in West Virginia. The film shows the story of a farmer, Wilbur Tennant, who observed that his cows were dying, and he knew that something was up, and he knew that it had something to do with the nearby DuPont factory. And he persisted in getting the attention of a lawyer, Rob Bilott, who fought for justice for the community. Unfortunately, industry was not forthcoming with what they knew about widespread exposures and health effects related to their chemicals. There was an important article in the New Yorker just this past year in May of 2024, written by Sharon Lerner, who some of you may know received the Rachel Carson Advocacy Award at our gala last October. The article described the work of a young chemist at 3M in the 1990s, who discovered that pretty much everybody had pretty much every blood sample that she tested had some level of PFAS, even people in the general population. This was really concerning because it suggested that these chemicals were widespread in the environment and in our bodies. However, 3M executives criticized her work and they suppressed her findings. And they hid what they knew about health effects, even as they were noticing and studying health effects in their workers who were highly exposed to these chemicals. Since the early 2000s, activists in dozens of other communities have also sounded the alarm about contamination in their communities, and they've demanded testing, cleanup, medical screening, and health studies. I think another reason why we're hearing so much about PFAS in the news is that we're learning just how widespread they are in the environment and in our bodies. PFAS have been called forever chemicals because of their strong carbon-fluorine bonds, which make them extremely persistent. In recent years, scientists have had access to more sensitive analytical methods, which have allowed them to measure PFAS in drinking water all around the country. And we've learned that they're really prevalent. The highest levels are often traced to fluoropolymer production facilities or to military bases and airports where certain PFAS-containing firefighting foams were widely used. But even more common sources like sewage treatment plants and landfills and even car washes can be sources of water contamination. PFAS are also considered global pollutants. They've been found in the blood of indigenous communities in the Arctic and in the blood of polar bears. They're even in rainwater. And according to studies by the CDC, they're in the blood of pretty much every person in the US. In recent years, the EPA and the US states have ramped up testing of drinking water, groundwaters, rivers, and lakes, and now increasingly focusing on fish and other types of foods as well. So overall, the more we test for them, the more we find them.
Right. Thank you for that background. So Laurel, can you tell us specifically about the study that you're leading, the Massachusetts PFAS and Your Health study?
Sure. So the Massachusetts PFAS in Your Health study is looking at the health effects of PFAS coming from drinking water in 2 communities here in Massachusetts. It's part of a broader study that is funded and coordinated by the CDC, so it's the Centers for Disease Control and Prevention, and their sister agency, the Agency for Toxic Substances and Disease Registry, or ATSDR. I have the opportunity to work with people in many different PFAS-impacted communities, and I often hear people say that they want to be part of a health study, that they want their exposures to count and to contribute to scientific knowledge. In order to do a health study, researchers need a lot of people to participate so that we have the statistical power to evaluate differences in disease prevalence or markers of health effects between people who've had higher levels of exposure compared to those with lower levels of exposure. Many of the communities that have been impacted by PFAS are too small individually for scientists to be able to learn a lot about health effects. So the overall goal for the broader CDC study, which is called the multi-site study, is to learn about the health effects of PFAS exposures from contaminated drinking water in adults and children. While there's a lot that we already know about how certain PFAS can affect our health, there is more that we can learn. So our study will address gaps in our knowledge about all the ways that PFAS can affect our health, about the levels of exposure that can be harmful, about the effects of mixtures, because we know we don't just get exposed to one PFAS at a time, and the effect of timing, because we know that our bodies are more sensitive during certain developmental windows, for instance, during pregnancy or childhood. So to meet these goals, CDC offered to fund and partner with research teams in 7 different states. And each of these teams were tasked with working with local communities to recruit residents of communities that had experienced elevated exposures to PFAS from drinking water. So back in 2019, Silent Spring Institute applied to be part of the study. And among proposals from research teams across the country, we were selected as one of the 7 projects for funding. So our study here in Massachusetts includes 2 communities. One is in Hyannis, which is on Cape Cod. Back in 2010, when we first started to look for PFAS in public water supplies on Cape Cod, we had noticed that Hyannis drinking water seemed to have higher levels of PFAS than other water supplies on Cape Cod. Later testing in 2013 to 2015, which was required by the EPA, showed that not only did Hyannis have higher levels than other water supplies on Cape Cod, but they actually had higher levels than any other public water supply in Massachusetts, and was in the top 1% of water supplies across the country. In Hyannis, the water was contaminated with PFAS from the use of a certain class of firefighting foam called AFFF, which is aqueous film forming foam, that were used at the county's fire training area, which is located really close to some of the Hyannis wells. We had been working really closely with Cheryl Osimo. She's a co-founder of Silent Spring Institute, and she's executive director of our sister organization, the Massachusetts Breast Cancer Coalition. And had been working for many years to share our findings with decision makers and residents on the Cape, and really to emphasize the importance of addressing PFAS in the water. So when we had the opportunity to apply to be part of the multi-site study, we naturally wanted to include Hyannis as part of that work. Our other community is the town of Ayer, which is west of Boston. I got to know Lori Nearing, the former president of the local advocacy group called PACE, which is People of Ayer Concerned About the Environment, back in 2019, not too long after the town had discovered PFAS in their drinking water. Lori had invited me to speak as part of a community meeting about water issues at the time. The drinking water in Ayer also had PFAS contamination, though the levels were not quite as high as in Hyannis. And in Ayer, the main source was traced to the use of firefighting foams at the former Fort Devens military base.
Right. And you said there are 7 sites, and I think that Silent Spring is the only nonprofit organization, right, that received funding.
Yeah, that's right. The other sites are mainly led by big universities or state health departments that have a lot more resources and a lot more experience doing these types of health studies. So it was definitely a lot of learning curves to launch a big study like this.
So on that note, Emily, you were deeply involved with recruiting people for this study. How many participants did the team recruit in the end?
So we recruited nearly 800 participants across both communities, and that includes both adults and children. As Laurel mentioned, this is Silent Spring's first large-scale epidemiological study since our original breast cancer in the environment study back in the 90s. So it was really exciting to be a part of. And for this type of study, I know Laurel touched on this a bit already, but we want to look at health effects. It's so important that we can recruit a large number of people to maximize our sample size. And again, this was a big undertaking for us as a small nonprofit. We were working alongside these larger research teams based at the universities with more resources and infrastructure that they've been dedicating to these sorts of studies over a period of years. So we were lucky to have a great field team and a fantastic team of consultants, community partners, and volunteers that helped us reach our outreach goals in both communities. And just to give a little bit more information on our recruitment, we used a lot of different recruitment strategies to spread the word to as many people as possible and to give them the opportunity to enroll in our study. We held public community meetings, film screenings, and events with local politicians. We sent a postcard to every person in the 2 communities whose residence was on the public water supply. We posted on social media. We set up tables at street fairs, and we posted up at the local mall in Hyannis pretty often, and in local grocery stores. One of our simple but successful methods in Ayer was to post yard signs all over the town, which we were lucky to have support from the town to be able to do that. And in Hyannis, we had a team of staff and volunteers who went door-to-door canvassing, which, if you've never done that before, requires a surprising amount of coordination. I wasn't personally very involved, but we had some dedicated staff and volunteers who made that happen. We were lucky, again, to have the support of our community partners throughout the process, NBCC in Hyannis and Pace in Air. We had local news media feature articles about our study, and we really couldn't have done it without, our local volunteers. We even had some high school students who volunteered and helped spread the word in their schools, since again, we were recruiting, children and adolescents into the study as well.
Great. So just following up on that, so it's such a big undertaking to recruit this many people, and then you had to collect all the data, right? So can you say a little bit more about what that was like?
Sure. Yeah, so as the study coordinator, I was involved in kind of overseeing the recruitment as well as the data collection process. I was primarily based out of our AIR office since I joined Silent Spring right as we were opening that office. The Cape Cod office had already been open for a while. There's a lot of preparation involved in starting up a study or starting up a site like this. And we were anxious to get started recruiting really quickly, but we had a lot to do before we could, bring people in for their study visits. When I started, I think we had a lease for our field office in AIR. We had hired one research assistant, and we had some furniture that we had inherited, I believe. But we still had to hire additional staff. We had to set up a lab space since we had to process and store our blood and urine samples on site. We had to get everyone trained on the study protocol and get started on community outreach. But I think when I first started, I think I remember we were interviewing candidates like the same week that I had first read the study protocol. So it was definitely a hit the ground running situation. Once we had our staff and we had our lab up and running, we were ready to start enrolling people. And with a health study like this, there's a lot to keep in mind when it comes to protecting confidentiality of participant data, making sure people who enroll are informed about the study and comfortable with the procedures, and making sure everything is documented really well. We also worked with children, which was new to me, and kids actually sign their own type of consent form alongside their parents. So we had to kind of tailor the language to make sure it was age appropriate and the kids understood what was going on. We often had like families come in together to our field office to complete the study procedures.
Interesting. And is it true that the pandemic hit at some point, right in the middle of recruitment, was it? Can you say more about that?
Sure. And this is before I joined the study. So Laurel, feel free to jump in if there's anything to add. I joined kind of when we still were taking precautions in our field offices, but we were able to get out in the community a bit more. When we first started recruiting, it was a bit more difficult to get people to, be willing to come into, our field offices. And we couldn't really do as much in-person recruitment and hold big community meetings. So I think that definitely caused kind of a wrinkle at the beginning of the study and then kind of throughout the process. And that was something that I think maybe, I don't know if Laurel, you'd like to talk a bit about that.
Sure, it definitely presented some challenges, even with the launch of the study. The study was led by CDC, and we had planned to get started in 2020. And so there were delays even with getting all of the protocols approved so that we could get started. And then there were certainly, I think, some people who were cautious about coming into a study office during a pandemic. Our AIR office was actually located in the local hospital. So I think there was potentially some people who were taking precautions. Certainly among our staff, as a public health study, we wore masks and we took a lot of precautions. But definitely there were challenges, and we couldn't, especially at the beginning, recruit in the same way that we had planned to. I do think that for some folks, though, the concern about immune toxicity and vulnerability and efficacy of vaccines, we can talk a little bit more later about how PFAS actually affect our health. But I think for some people, it might have gotten them a little bit more concerned about some of the ways that PFAS might have been interacting with their COVID experience.
Interesting. So Emily, what was it like working with the community? Was it hard getting people to sign up aside from the COVID issues?
Yeah. So in my experience, there was a high level of awareness around the PFAS problem in air. Many people were interested in getting their blood levels tested because they'd been hearing about this for years. And I think there was like part of it was just like that level of curiosity and wanting to know what was going on in their own bodies, like in relation to what had been happening in the town with the water supply. And a lot of people also expressed interest in being a part of a study that could lead us to a better understanding of health impacts from PFAS exposure, like whether or not they themselves were experiencing any health impacts or any health issues. So definitely there was a lot of interest. There were definitely some challenges as well. I think it was hard for some parents to bring their kids in to get their blood drawn for something like a research study where it's not medically necessary. Like for some kids, it was their first blood draw, I think. And we kind of have whole families come in on a school day often, since our school vacation appointments filled up really fast. And they would spend the morning hanging out in our waiting room, like going over all the consent forms and the procedures, and they'd have to kind of troop down to the phlebotomy department of the hospital to wait for their blood draws. And we had some pretty extensive questionnaires to fill out, which would fall to the parents. So not everybody we spoke to wanted to do that. Our job was to give people the information that they needed to make that decision about whether or not to participate, and not necessarily to convince them one way or the other. But I found that there were so many individuals and families who were highly motivated to get involved, and they would come in just already knowing a lot about PFAS, which was great. We also spoke to, I think Laurel mentioned some people were interested in the immune effects of PFAS. We spoke with people who had, maybe a specific interest in a health effect that they had heard about. We spoke to parents who were concerned that they may have passed their PFAS exposures onto their children through placenta or through breastfeeding, which we know is possible. So some of the parents had lived in the study area during the period where the water was contaminated, even if their children were born after that period. They still could have been exposed in that way. So there were, people who had an awareness of that. And other people shared with us that they had health concerns that they believe may be attributed to drinking PFAS contaminated water, or that their friends and family in the community had health concerns. Another challenge we faced was that we did have specific criteria that we had to follow, or criteria that residents had to meet in each community in order to enroll in the study. So for example, in Hyannis, people needed to have lived there before 2016, which is when the water system was first treated for PFAS. And we spoke with quite a few people during our recruitment efforts who were interested in participating, but maybe they moved to the Cape in, 2018 or something after the water had been treated, and so they were not eligible. There were also, some people who lived on private wells. We didn't enroll anyone on private wells. That was just part of our criteria. It was also somewhat challenging in Hyannis, recruiting people in a community with so many seasonal residents, since Hyannis kind of grows in size during the summer and then shrinks again in the fall. So our summers were busy with recruiting people, since we did enroll people who were part-time residents as well as full-time. But overall, we had so much support and interest from both communities. It was a great experience to get to work with the community in AIR.
So Laurel, you analyzed these participants' blood samples for PFAS. Can you tell us what you found?
Sure. So Emily described the process of collecting blood and urine samples in the field office. And after we collected those samples, some of those blood samples got sent to Atlanta to the CDC lab, where they were measured for PFAS. Other samples got sent to a local LabCorp office where they got, or lab where they were tested for things like cell counts and cholesterol and thyroid hormone levels. And so we received the results back from the CDC lab and have had a chance to analyze those results at a community level, as well as to share results at an individual level. Looking at the community level results, one trend that we noticed was that the average blood levels were higher among our participants in Hyannis than those in AIR. This was not unexpected for us, because we knew that historically the water in Hyannis did have much higher levels than the water in AIR, so that was reflected in the blood levels. We did also see that the levels of PFAS in our two communities for some of the PFAS chemicals were elevated above the general US population, even though the water in Hyannis and AIR was being treated at the time of the study. And that's because PFAS chemicals can stay around in our bodies for a long amount of time. So people, especially people who'd lived in the area for a long time, had accumulated these chemicals in their bodies. It takes a long time for our bodies to excrete these chemicals. And so they were still carrying around elevated amounts of PFAS in their blood, even though the levels in the water were basically not detectable. Some other trends that we noticed were that older adults tended to have higher levels than younger adults, and that's likely because they were exposed to PFAS over a longer period of time. And again, we know that PFAS can accumulate in our blood over our lifetime. We also saw that men on average had higher levels than women, particularly in premenopausal age participants. And this is something that's been seen in other studies as well. And we think there are a couple of contributing factors to that. We do know that PFAS can bind to proteins in our blood. And so women can have lower levels of PFAS in their blood than men because they lose blood through menstruation, whereas men don't have that way of kind of losing PFAS from their bodies. Unfortunately, we also, as Emily said, we know that PFAS can be passed along during pregnancy and during breastfeeding. So unfortunately, that means that babies are born pre-exposed to PFAS, but that also means that we see a concurrent decline in women's blood as well.
So how did you share the results with the participants, and what were some of the reactions you received?
Sure. So we had a couple different types of results to share back with participants. Like I said, we had lab core results. Some of these were kind of routine tests like cholesterol, which are things that maybe are part of routine healthcare. Others are kind of less common tests that you might only get if your doctor was trying to figure out why you had symptoms of a certain disease. So things like thyroid hormones aren't typically tested as part of that. So we did share those results back with participants, and we were able to receive those results pretty quickly. And the LabCorp report would flag if there were any results that were sort of out of the normal range. The PFAS results took longer to get. The CDC lab had lots of PFAS results to test for, so there was a little bit more of a delay there, but we aimed to be as prompt as we could in sending results of the PFAS back to our participants. And these reports showed the levels of 7 different PFAS chemicals for the individual and compared those levels to the general US population. We also had, we shared more detailed community level findings through community meetings in Hyannis and in Air last June, and those are recorded. So if you look at our Silent Spring website, you can find the video recordings if you want to delve a little bit more deeply into the specific details of the findings for the 2 communities. In terms of people's reactions, some people definitely, as Emily mentioned, were curious and wondering if their own health conditions maybe were related to their PFAS exposures. I remember one woman from Hyannis who mentioned having high cholesterol and also thyroid disease. These are both conditions that have been linked to PFAS exposures. So she was concerned that her past exposure to PFAS from the water was contributing to her health. And in her blood test results, one of the PFAS in her blood was 15 times higher than the national average. It's important to note that there's no way for us to know at an individual level whether chemical exposures contributed to any one person's health problems. Our study was designed to look more broadly at a population level, and we know that many of the types of health effects associated with PFAS can also be traced to other factors as well. People who were concerned to have elevated PFAS in their bodies also wanted to know ways that they could reduce any additional exposure. So we've got a lot of questions about water filters and a lot of questions about how to find products for their homes, schools, for their workplaces that don't contain PFAS so that they can restrict or limit any additional PFAS exposures moving forward. And then another type of question that we received was how to talk about their results with their doctors. Often the advice for people when they have information about chemical exposures is to go bring the results to their doctors. They're trusted sources for understanding health questions. Unfortunately, many doctors aren't trained much on environmental health in general. So the idea that our environment, chemicals in our environment can affect our health. And PFAS are a really new topic. So, the doctors and other clinicians haven't received a lot of training and don't have a lot of knowledge about how PFAS can affect their patient's health and how to sort of have that conversation. And we also know that clinician awareness can improve health outcomes among people with high exposures. I was inspired to hear the story of Sandy Wenstell, the resident of a PFAS impacted community in Michigan. She had quite high, very high levels of PFAS in her private well water. Her home was located near a former hush puppy shoe factory where they added PFAS as waterproofing agents to the shoes. She had already lost her husband to liver cancer when she also started to experience poor health. Her doctor was aware of her high PFAS exposures and the types of health effects associated with PFAS. And he was able to more quickly diagnose her as having thyroid cancer. And he said that if he didn't have that knowledge, that he wouldn't have been able to address her illness as quickly. So that's an example of how clinician awareness can improve clinical care. As part of a different study that we're leading called PFAS Reach, our team worked with other researchers and clinicians and community members to develop resources for clinicians, including a continuing medical education course to inform doctors about the types of health effects associated with PFAS and different types of screenings that they can consider for people with elevated exposures. Members of our team also provided input into a groundbreaking 2022 report by the National Academies of Sciences, Engineering, and Medicine. The study recommended PFAS blood testing should be offered to people who are likely to have elevated exposures to PFAS. And the report also helped provide a framework for interpreting the results of PFAS blood tests in terms of different types of screening that might be appropriate based on the results of those PFAS blood tests.
So interesting. So, that case study in Michigan, maybe you mentioned this, but in the letters that you sent to the participants, were they encouraged to bring those results to their doctors if they had concerns?
We did share the resources that we developed for clinicians because we knew that some participants would likely want to bring the results to their clinicians, and knowing that they might not have had that information about PFAS, we wanted to help inform that discussion by sharing the resources we developed. We had two fact sheets, one for patients, which was more general, and then another specifically for clinicians.
Wonderful. That's great. So switching gears a little bit, Emily, you came to Silent Spring from a more medical setting, having worked on drug trials at Brigham and Women's. How did that experience compare with the one you had at Silent Spring?
Sure. So I had started working in clinical research several years ago. At the time, I was considering applying to medical school, and that's kind of what you do to get some clinical experience, or one of the paths you can take. And during my time at Brigham and Women's, even though patients came into our clinic to participate in research studies, a lot of them opened up to me about their struggles navigating the healthcare system, accessing care. They talked about, stigma that they experienced surrounding certain health conditions. And I realized that so many individual patient concerns that I was hearing about were related to these larger systemic problems. So I became curious about preventative care and population health, and in kind of working with communities to address the systemic problems I was hearing about. And a few years later, I enrolled in a Master of Public Health program where I ended up focusing on environmental health. So I was excited about the opportunity to coordinate the Massachusetts PFAS in Your Health study, because it allowed me to apply these skills that I had spent several years learning working in a clinical research setting, but to a subject area that's very important to me. I think Laurel touched on this, but for doctors, environmental health is often a footnote in their education at best. And it was not really something that I had explored until graduate school, when I took a few courses, and I realized just how important environmental health is for all of us, and how it just ties together so many issues. In my role at Silent Spring, I had the opportunity to apply what I had learned and train our field staff on, clinical research practices, such as working with study participants, documenting results, and adhering to regulations. And I learned a lot from this project about Silent Spring's approach to working with community partners and reporting results back to participants and to the general public, which was really great. There's usually some kind of report back involved in research, and I'd always felt pretty strongly that it was important to share results with participants. But Silent Spring really lives out this value, and it's become this model for best practices on report back. We put a lot of thought into how we report study results to individual participants in a way that's digestible, understandable, and when possible, actionable. And for this study, we also reported community level results at these public forums, which gave people in communities, whether or not they participated in the study, gave them a chance to come and ask questions and speak with us directly, which was really great.
So now that you've shared the study results with the communities, what's next for the project?
Great question. We've got a lot on the horizon. So we'll be looking more closely at the health effects of PFAS exposure, using the results not just from Hyannis and air, but from all of the other study sites combined, from the PFAS multi-site study overall. So by kind of pulling together the results from all the sites, we'll have data from lots of people, which will give us greater confidence in our results as we start to examine the relationships between PFAS exposure and the health effects that were reported by our study participants. So we have several different papers that we're working on different health effects. My colleague Yutang Wang, a postdoc at Silent Spring, is currently leading a paper on PFAS and hypertension and high blood pressure. There will also be a paper led by CDC kind of summarizing the PFAS blood levels across all study sites. So that will be similar information to the information that we have shared on just Hyannis and air with communities and during our public forums. And we hope that that paper will be out in 2025 at some point. Over the next year, we anticipate like several additional papers on a variety of health outcomes that will be, we hope to be submitted to journals. And the idea is like we hope these papers will inform future policy around PFAS in drinking water, since we just have so much information and so much data to work with on different health effects. There's just like a lot going on. Just a few other studies that we're working on or papers we're working on at Silent Spring. We're currently analyzing the data that we collected here in Massachusetts. We did some additional questionnaires on diet and consumer products on just our Massachusetts participants. So we hope to submit a paper on that this year. We collected, I think if anyone's on the call who participated, pretty extensive data on just diet and consumer products. And we're looking to see if the products and foods that are associated with, which products and foods are associated with higher PFAS blood levels. We found some evidence, for example, that PFAS exposure can be higher in people who consume more fish. So we'd like to kind of explore that further. And I'm currently leading a paper looking at residential history, so how much time people spent in these areas during the period where the water was contaminated, and drinking water exposures in our two Massachusetts communities. One of the findings that we can share from that paper is that people who filter their drinking water tend to have lower PFAS blood levels, or people who filtered their water during the period where the water was contaminated tend to have higher PFAS or lower PFAS blood levels. That's not entirely surprising, but it's important to kind of get these papers out there. And we're also continuing to work with hydrogeologists on reconstructing past exposures to PFAS from drinking water in both Hyannis and air. And that historical reconstruction, along with the results of the PFAS blood tests that we collected, together will give us a better understanding of how residents in these two communities were exposed to PFAS over time.
Great. Laurel, beyond the study participants, who's going to use these results and how?
Great question. So we anticipate that these results can inform and bolster regulations that aim to reduce exposures that can affect people's health. For instance, last April, the EPA set drinking water standards called maximum contaminant levels for 6 PFAS chemicals. Bolstering the scientific evidence for those standards is more important than ever, given talk of efforts by the new administration to roll back regulations at the federal level. And there are also lawsuits by industry and trade groups to weaken those PFAS drinking water standards. As Emily mentioned, we asked participants about their use of certain consumer products and different types of foods that they eat. And so based on those results, that information can help us make better recommendations about how people can reduce their exposures. Again, at the federal level, given the current administration's stated priorities, we don't expect to see new regulations at the federal level to reduce exposures and protect the public from these harmful chemicals. However, we have seen that many states have stepped up to enact restrictions on PFAS in products, so our results can support those efforts. In addition, we share our results with community members as well, and through our smartphone app called Detox Me, and disseminate our findings to give people tips for how they can reduce exposures in their daily lives. Consumers, through their purchasing power and through advocacy, can encourage retailers to turn off the tap and stop manufacturing and selling products with PFAS. For people in Hyannis and Air and other communities, the results could help inform guidance for clinicians about how to monitor and screen their patients for various health effects. And our team here at Silent Spring continues to inform legislators about the need to do more, not less, on PFAS. In December, I had the opportunity to speak at a Senate subcommittee hearing about the need for stricter action to reduce exposures to PFAS and to turn off the tap on unnecessary uses of these chemicals.
That's great. And I want to just reemphasize the point you made about the Detox Me app, which, as we all know, is great for all kinds of general environmental concerns and consumer products and so forth. So those of you listening, if you haven't yet downloaded it for yourself or your loved ones, it really it's an amazing tool that Silent Spring created. So this has been great conversation, and thank you both for your work. It's so important. Without these studies and without this kind of data, people can't know about the harmful chemicals in their daily lives. And doctors can't make informed decisions, scientists can't track trends in the population, and policymakers can't create policies to protect the environment and the human health without this kind of work. So I'm grateful to our audience members for your time today and your belief in our work. And I want to say a special thank you to the individuals and foundations who generously support Silent Spring science. This kind of support makes the work possible. And at this time, I'd want to open it up to our other guests and invite folks to ask questions. If you have a question for Laurel or Emily, please put it in the chat and it will go directly to Alex, who will read it out loud for us. And we'll do our best to answer all your questions, but if we do run out of time and we don't get to all of them, we'll make sure to follow up afterwards. So Alex, what do we have for questions to start with?
Thank you, Beth. Well, we have so many great questions that have come in. It's really amazing. I love the engagement. I think I'm going to start off with one question that a lot of people have been asking about, that's on a lot of people's minds. It goes, was there political pushback? This is for you, Laurel. Was there political pushback against your study? And with the current administration, how is that impacting your work? Is the government going to continue supporting research on PFAS?
Sure. So the multi-site study overall did receive bipartisan support when it was funded back in 2019 as part of the National Defense Authorization Act. PFAS really are a nonpartisan issue, and they affect people in every part of the country. In general, for the communities where we did our work, we definitely received support from the leadership of both towns where we were recruiting participants. And so we appreciated that support from the elected officials. As Beth mentioned at the beginning of the program, we're entering a challenging period right now. You likely have heard about recent executive orders that have threatened federal funding for research, including our own PFAS research. So we are definitely concerned about future investments in this work and on other environmental exposures. In addition, federal agencies are actively blocking public access to vital communications and scientific and health data. Last Friday, the CDC began removing health data from its website, with some news reports indicating that more than 1,000 federal web pages had been removed, and websites from other agencies were unavailable or stripped bare, including those related to climate change and health, and the NIH Office on Research and Health. So while some of these pages are back online, we're not sure if some of the information has been removed, and the uncertainty about the availability and the completeness of these data sets is really disruptive to our work. Silent Spring scientists and other research groups rely on these large sets of publicly available data to study exposures to harmful chemicals in the general US population. So this uncertainty and these conditions make it difficult for us to do our work. In terms of our study specifically, it's funded and coordinated by the CDC and ATSDR. So one concern we have is whether CDC will actually allow the publications to go through the clearance process, which is a part of the research process for government scientists. Right now, the CDC staff who are part of the study are not allowed to communicate in meetings through our study team. So there's concern that the broader public won't see these results. We can publish the results just for our Massachusetts participants for the studies or the papers that pull together the results compiled by all of the sites combined, we can learn so much more. So we're concerned about any restriction or slowdown on publishing those findings.
Great, thank you. We received a lot of questions about filtering your drinking water for PFAS. So what's the best way to filter out PFAS in my drinking water at home? Yeah, I think Emily, maybe you want to try that one?
Sure. Yeah, it's a great question. There are two main types of filters that can remove PFAS from drinking water, and those are activated carbon filters and reverse osmosis. Activated carbon filters can be installed either at point of entry, which is where the tap water enters your house, or at point of use. And point of use can be something like a filter attached to your kitchen sink. It could also be a filter sitting on your counter or even a pitcher filter in your fridge. Activated carbon filters are a relatively low-cost option, and they're effective at removing long-chain PFAS, such as PFOA and PFOS. They're not quite as effective at removing the shorter chain PFAS, especially kind of over the lifetime of the filter. Reverse osmosis filters are the most effective at removing both long and short chain PFAS, but they are more expensive, and typically they'll be installed at point of use in one place in your house, such as at the kitchen sink. Regardless of which type of filter you choose, you want to make sure that you choose one that's NSF certified, and we can provide a link to that information, I believe, after this call. And you also want to make sure that you're changing out any filter components as instructed by the manufacturer. That's really important. And we can provide some more information as well if anyone has additional questions.
Great. Somewhat related to that, we had a number of questions of people just asking about, like, how is PFAS removed from public water supplies in general? If you could say a little bit about that. And also just to clarify that the water in Hyannis and Air is currently being treated. Is that right?
Yes, that is correct. The water in Hyannis and Air is currently being treated, and Massachusetts has some of the strictest standards in the country for PFAS in drinking water. Laurel, would you like to talk about how the municipal water supplies filter their water?
Sure. So as Emily said, both Hyannis and Air are filtering their water to remove PFAS. Hyannis started to put in place activated carbon treatment in 2016. They have wells in 3 different parts of town, so they addressed each of those well fields separately over time. So those are all activated carbon filters. And then in Air, there are 2 different well fields in different parts of town. And one of the well fields started to be treated after the discovery of PFAS in 2018. And that well field is being treated with activated carbon, and then wells on the other side of town are being treated with ion exchange, which is a different type of water treatment. So it's important to note that the water is being filtered for PFAS now.
Great. Another question about bottled water. People want to know, is bottled water any safer?
Sure, I can talk about that. So bottled water may not be safer, since many bottled water companies actually get their water from municipal water supplies, where they're not required to, the bottled water is not actually required to be tested for PFAS. Many public water supplies, including those in Massachusetts, are required to test for, or many public water supplies, including those in Massachusetts, are required to test for PFAS, and they're required to address the issue if the levels exceed the state standards, which again are pretty strict in Massachusetts. In other states, municipal water supplies will have to meet EPA standards by 2029. So in general, there's just more testing and treatment of PFAS in public water supplies than for bottled water. Bottled water is regulated by the FDA rather than the EPA, so it's just not subject to the same standards. That being said, bottled water can be a good short-term solution. For example, if you have PFAS contamination in your water supply, whether that's municipal water or a private well, kind of while you're in the process of maybe installing a filter, bottled water could be safer in that case, but it's just not a great long-term solution for avoiding PFAS, and it also poses, some additional issues, including sustainability and possible exposure to chemicals that leach into the water from the plastic bottles.
Great, thanks. Here's another question. At what levels do we see health effects from PFAS, and what are they?
I can chime in with that one. Yeah, that's a great question, and certainly one of the goals for this study is to learn more about the types of health effects linked to PFAS exposures and the level of exposures at which those happen. Exposures to PFAS, especially legacy PFAS chemicals, so PFOS, PFOA, the chemicals that have been in production for the longest amount of time, have been linked to many diseases and markers of health effects. The list is long, but just to name a few, PFAS exposures have been linked to increased cholesterol, higher blood pressure, lower antibody production following routine vaccinations, particularly in kids, small decreases in birth weight, thyroid disease, and certain types of cancer. So scientists and regulators at the EPA and state agencies have compiled information from studies in people and from laboratory animals to develop standards and regulations designed to protect people from harmful health effects. So there's not one single number where we can say, okay, above this level, you're likely to have higher risk of a disease. There's so many different types of diseases linked to PFAS. The standards and regulations are meant to be at a level low enough so that people of especially vulnerable groups, pregnant women and kids and infants, are being protected from the harmful health effects. And one thing we've also seen is that over time, these health guidelines and standards have gone down. So they've gotten stricter over time as we've learned more about the harmful effects of PFAS. Back in 2009, when we first were testing for PFAS in public water supplies and looking to interpret our results, the EPA guidelines at the time, so they weren't enforceable, but they did have guideline levels, were 400 parts per trillion for PFOA and 200 for PFAS. The standards that they issued last year were 4 parts per trillion. So that really reflects that the level of knowledge of low dose health effects is increasing, and over time we might expect to see even stricter levels.
Great. Related to that, sort of, you guys mentioned earlier about Massachusetts strict drinking water standards. There's a question here: will Massachusetts lower its standards for PFAS to match EPA's? And then just maybe, Laurel, if you could then also talk about more broadly, what is Massachusetts as a state doing about PFAS in general?
Sure. So specifically related to PFAS, as I said, the EPA established federal drinking water standards just last year in 2024. Before that, they only had non-enforceable guideline values. Regulators in some states, including Massachusetts, saw the need to act more quickly to protect their residents. So Massachusetts Department of Environmental Protection established standards in 2020 that limited the total amount of 6 PFAS chemicals in drinking water supplies here in Massachusetts. So water supplies here in the state have already had to start testing for and addressing contamination of water. Now that the EPA standards are in place, and those are really, in essence, stricter than the Massachusetts standards, Massachusetts water supplies do need to come into compliance with those federal drinking water standards. In addition, so that those standards only apply to public water supplies. Private well owners don't, for the most part, have to meet drinking water standards, but it's important for well owners to monitor their own water quality. PFAS testing can be expensive for individuals, and so the state did offer PFAS testing for private well owners in 80 different towns. So several thousand well owners took part in that, and those results are available on the DEP website. Beyond water, I think there's kind of growing recognition that there are other ways that we can be exposed to PFAS from the environment, particularly fish and shellfish and other types of foods. So the Massachusetts Department of Public Health and the Department of Environmental Protection have conducted testing on fish, and there are established fish consumption advisories and some do not eat advisories for some ponds in Massachusetts. And then legislatively, there were a number of bills that were proposed in the last legislative session. One that did get passed banned PFAS in firefighter gear. So some people can have even higher exposures from on-the-job sources. So firefighters may have elevated exposures from PFAS in certain types of firefighting foam. And then some of the gear that they wear also typically has had PFAS containing layer as an added barrier. Fortunately, there are alternatives, so PFAS-free firefighter gear. So at a legislative level, Massachusetts did ban PFAS and firefighter gear last year, and there's additional legislation that's being considered that would ban PFAS in consumer products. And it's great to be partnering with Mass Breast Cancer Coalition because they do a great job of staying on top of proposed legislation here in Massachusetts. So if you want to learn more about the bills that are currently being considered, and I would recommend you visit their website.
Great. The next question is, have you made progress engaging clinicians in this subject? Is there any movement towards educating local healthcare providers about what to look out for in their long-term Hyannis residents? I found that my doctors are unfamiliar with PFAS, and we had elevated levels in Hyannis until 2016.
Sure, I can tackle that one. So early on in our study, we did try to engage with clinicians in our communities. We did do some presentations for a group of pediatricians in the Hyannis area, and we did other outreach to clinicians in the communities. It was during the pandemic. I think that was one thing that made it challenging, was that we had hoped that clinicians would be able to maybe help us with spreading the word about the study, and they just had so much on their plate at that time. But as I said, with our PFAS REACH study, for which we partner with Northeastern University and Michigan State and community partners, including MBCC, we created resources for clinicians in the CME course. And working with our partners, we've been aiming to share those resources more broadly with clinicians in our communities, but also other communities as well. And I know the Northeastern team is also aiming to interview clinicians who take our CME course to evaluate how well it helps address their questions and how they might integrate that into their clinical care. And I think over the coming years, we get deeper into the analysis of our data and thinking about what can we learn about health effects from our study. We do want to do more to engage with the clinicians in our communities specifically.
This is an interesting question. Is it possible to find and study those few people who do not have PFAS in their bodies? Maybe there's a reason, either they're not exposed or there's something about their own biology that means they don't store it the same way as the average person. But do you know anything about that, Laurel?
I think it's pretty hard to find anyone without any PFAS, measurable PFAS in their bodies. The National Health and Nutrition Examination Survey, or NHANES, periodically tests a representative sampling of people in the US, and they find over 99% of the people that they test have PFAS in their blood. So I think it's pretty challenging to find people who don't have any PFAS, but we can learn about important exposure pathways by comparing people who have lower levels versus those that have higher levels. For instance, Silent Spring led a study in 2019 where we saw that people who reported eating more microwave popcorn had higher levels of PFAS in their blood. And in a related study, people who had stain-resistant carpets in their house and used oral B Glide dental floss also had higher levels of PFAS in their blood. So it's pretty hard to find anyone who doesn't have any PFAS in their blood, but we can look at higher exposed people compared to lower exposed people and try to figure out where those exposures are coming from.
Great. Here's one for you, Emily. What can people do to avoid PFAS in the short term, and how can they support efforts to eliminate PFAS in the long term?
Sure. Yeah, it's a great question. I think most importantly, if your drinking water is contaminated with PFAS, you can install a filter. I think there's a lot to say about other exposures, but drinking water is just such a common exposure that I just wanted to mention that again. Some of the other things you can do to avoid PFAS in the short term, you can read product labels and avoid products that claim to be stain resistant or waterproof. Those products are very likely to contain PFAS unless stated otherwise. I think there's been some efforts by some companies to kind of phase out PFAS. It's so that there may be updates on this in the coming years, but Silent Spring published a study in 2022 that showed that many textiles, including those with green certifications, did contain PFAS. So it's just good to look out for those labels. You can also find more information about PFAS containing products on our Detox Me app. Just another plug for that, which contains a lot of tips for avoiding exposures in general and specifically PFAS as well. The Green Science Policy Institute is also a great resource. They have a list of PFAS-free products on their website. Then to support kind of efforts to eliminate the chemicals in the long term, you said as well. For that, you can kind of get involved in your community. You can, signal to retailers that you want PFAS-free products. And I think there is an awareness among a lot of brands now that people do care about this issue. So just kind of keeping that momentum going. And you can support policies that restrict PFAS. Just a couple other things you can do to avoid exposures. There is there's some evidence based on previous Silent Spring research that shows that people who eat more fresh foods prepared at home rather than eating out or eating takeout can have lower levels of exposure to PFAS. I don't think any of us can do that 100% of the time, but it's good to just it's kind of with like you're reducing your exposures. It's kind of like every little bit helps. And then you can also pay attention to freshwater fish can be a source of PFAS exposure. So if you do fish, you can pay attention to fish and game consumption advisories in your community. There's been a lot of work done at looking at, sorry, lost my train of thought for a second, but yes, there has been a lot of research done in Massachusetts just looking at fish in freshwater sources such as ponds and rivers. So it's definitely something you want to look into if you do consume freshwater.
Great. This is a specific question about takeout food containers. Should we assume that all paper-based takeout food containers contain PFAS? So things like from salad bar boxes, bowls, bakery paper.
Yeah, it's a grease question. So technically, the FDA no longer allows PFAS to be used in food contact containers. So that will include like the grease-proof linings that we associated with PFAS previously. They don't allow this to be sold in the US. Imported food packaging is also not supposed to contain PFAS, but we have some doubts about kind of how that's being enforced. So I think at this point, it's still a bit hard to tell, and we still are suggesting that it's better to kind of avoid too much food packaging. There's also other reasons to avoid food packaging since some plastics may contain PFAS. And there's a lot of plastics involved in food packaging, even where you might not know that there's plastics there. Like in paper cups, there can be plastic components, and food packaging also can contain other harmful chemicals besides PFAS.
Laurel, here's a question for you. Have you found that a community's socioeconomic status correlates with their drinking water PFAS levels?
Yeah, that's a great question. And we actually just this past January published a study led by one of our research associates, Aaron Maruzzo, where we analyzed results from EPA mandated testing for PFAS and other unregulated drinking water contaminants. We found that in general, this was testing done across the whole US, that public water supplies serving higher proportions of Hispanic and non-Hispanic Black residents were more likely to live close to sources of PFAS contamination and more likely to have PFAS in their drinking water, as well as other unregulated contaminants as well. And these trends didn't seem to be explained by income, since we generally didn't see higher rates of PFAS detected in water systems serving lower income communities. So this work was based on testing that had been done in 2013 to 2015. EPA is now requiring water utilities to do more updated testing, so testing for more PFAS chemicals and with more sensitive methods. So we'll have a better picture of the levels of PFAS in water supplies across the country. And so we want to ask those same kinds of questions and see if we're still seeing those same types of disparities in terms of exposures. I wanted to say that this type of environmental justice research is really important for identifying communities at greatest risk of exposure and in greatest need of support to address contamination. I would mention that federal funding for this type of research on environmental justice is now under attack, and we think that it will be harder to fund this work in the future with federal grants. And we're definitely committed to doing this type of work. So support from donors and foundations and other sources will be critically important for us to keep this research moving forward in the future.
Great. A number of people have written in with questions about, do you have any advice for people, exposures among their pets or even backyard chickens, vegetables, eggs, that sort of thing?
That is a great question. We haven't ourselves done any testing on pets. Previous studies have found that pets can have higher levels of chemicals like PFAS and flame retardants in their blood. They spend more time on carpets. They spend all their time in people's houses. And so they can kind of be sentinels of exposure to chemicals that are in our home environments. Just like with people, we're still learning about what that might mean for our health. We've definitely gotten questions, particularly in areas like Hyannis, where the water used to have high levels of PFAS. People are concerned about accumulation in yard soil, and to your question about growing chickens in the backyard or even homegrown produce. And I think that we're still sort of in the early stages of really understanding, how much like elevated PFAS there might be in soils. That is something that we would like to do in some of our future testing. And so I think it's really it's hard to answer those questions at this point because we're likely to find PFAS where we test for them. And so in terms of developing recommendations for what's a safe level, we're pretty far from that. It's not like lead where we have screening levels for acceptable levels that might be in residential soils. But I think that's an important area for future work.
We have some questions about, are there any links between PFAS and breast cancer? What can you say about what we know so far?
Sure. So according to laboratory studies in rodents exposed to one PFAS chemical called PFOA or C8, studies found that in these rodent studies that this PFAS can impair mammary gland development. This is concerning for us because we think that chemicals that impair mammary gland development could increase breast cancer risk later in life. There is also some evidence of that PFAS exposures in people can increase breast cancer risk, but there is also some inconsistencies in the results. And as we learned through our earlier breast cancer, Cape Cod breast cancer in the environment study, it can be really challenging to make links between exposures and breast cancer because we know that there are critical windows earlier in people's lives, and it can be difficult to kind of characterize those past exposures. I mentioned the 2022 National Academies panel that came up with recommendations for clinicians. As part of that work, they did a comprehensive survey of published studies based on epidemiological studies, so studies in people and toxicological studies. And in their report, the panel listed that there were, or concluded that there was limited suggested evidence for links between PFAS and breast cancer, and kind of identified that as an area for future work. In the report, the panel listed breast cancer screening for people with PFAS exposure within kind of typical standard of care, but it did kind of elevate concerns about breast cancer potentially being linked to PFAS exposure.
Okay, I'm going to just stay on you, Laurel, for one more question, and then I've got another one for Emily. For people who have high blood levels of PFAS, are there any interventions or technologies available for them to reduce their blood levels?
Mm-hmm. Yeah, this is definitely a question that I've heard from many people in PFAS impacted communities. And there's not really an easy answer. I would say there have been some clinical trials with published studies that have showed that. So for instance, there was a study of Australian firefighters. They looked at, I think it was both blood donation and plasma donation. Again, PFAS can accumulate in our blood. So they looked at the effect of donating blood over time, and they did see that was able to lower PFAS in the firefighters' blood. But I think we're a little bit far from a doctor like recommending that to their patients as a way to lower their levels. But that is something that could work, I suppose, to lower levels. Another potential option out there is a drug called cholestyramine. So this is an earlier generation of a cholesterol lowering medication. People who took part in the C8 study in West Virginia, so from the film Dark Waters, this was a large epidemiological study done in West Virginia. And it was seen that people who were taking that medication, not related to PFAS exposure, did have lower levels of PFAS or certain PFAS in their blood. And anecdotally, we know that some participants in our study have asked questions about taking cholestyramine as a way to lower their PFAS exposure. And there was a clinical trial, I believe, published last year that did show that some PFAS could be lowered by people taking this medication. Any medication has side effects, and we're certainly not I'm not a medical doctor, so not in a position to provide medical advice. So those are two sort of, I guess, potential options that are out there, but I think there's sort of a lot more work to be done before that would be something that doctors would recommend to their patients. It's different than like when people have high metal exposures and there's chelation therapy that's been around for a long time and is well tested. Again, PFAS are just a newer topic, and so those kinds of interventions are not well developed yet. But I hope they will be, because I know hearing from people who have high PFAS in their blood that they really want options for lowering that.
Great, thank you. Emily, someone wrote in to say they had their blood tested for PFAS and they're concerned about potential sources that might have contaminated their private water well. What's your advice?
Sure. So if they're interested in getting, if anyone on the call is interested in getting your private well tested for PFAS, there's a database that we can provide with accredited well testing. If you're in Massachusetts, the Massachusetts Department of Environmental Protection also has a list of labs on their website that they have certified for testing drinking water for certain types of contaminants, which includes PFAS. It also could be helpful, and depending on kind of, if you live in Massachusetts or if you live elsewhere, small town, you could reach out to your local health department to see if they have any free resources for available testing. Some health departments or towns have programs that can help pay for testing. You could see if there's been testing done on any nearby water systems. If your private well is located near the source for a municipal water system, you could see if there's been testing done already there. Health departments also could have some information on potential sources of contamination. And lastly, there is a website called the PFAS Exchange. I'm not sure if we've mentioned this quite yet on this call, but it's a resource developed in partnership with Silent Spring, Northeastern University, and some other collaborators. And it's a great resource in general, but it has a map, like an interactive map that shows known or suspected PFAS contamination sources. We can provide that link as well. But that might be a good place to start if what you're really interested in is where the exposure comes from. And then, separately, if you'd like to get your well tested, there are things you can do to look into that. If that doesn't answer your question, feel free to reach out to us and we can help you find more information.
Great. Another question sort of related to testing. Someone asked, is commercially available PFAS testing worth it? And how can we get it covered by insurance?
Yeah, that's another good question. Getting your blood tested for PFAS, I would say is like a pretty personal decision, depending on that depends on a lot of different factors, and it may or may not be covered by insurance, unfortunately. In New Hampshire, insurance must cover PFAS testing under certain circumstances. I see there are some people from New Hampshire on the call. Anecdotally, we have heard mixed reports as to whether it's actually been covered. I believe it's less likely to be covered in Massachusetts, although not impossible. We have heard from some doctors working with PFAS impacted communities that it can be helpful to have PFAS blood results, particularly if they can be monitored over time. So if you can get your blood tested a few times. And the National Academies provides guidance for clinicians. I think Laurel mentioned this earlier, that they should maybe prioritize certain tests in people with higher levels of PFAS in their blood. It's not necessarily widely known among all clinicians, so some doctors may be more informed about PFAS than others, and may have heard of this guidance or may not have heard of this guidance. And many of the tests that the National Academies suggests are also part of routine healthcare, like getting cholesterol screenings and things like that. So it might be the tests that they're recommending for somebody with higher PFAS levels might be tests that you've already had as part of your routine care. Again, like neither of us are medical doctors, so we can't, directly provide any medical advice, but this is the what we have available to us. And if you have information on your exposure, that could also provide information for your clinician, even if you choose not to get your blood tested, just knowing that you've been exposed to PFAS through drinking water or through some other source, that could just be informative. If you are interested in getting your PFAS blood tested, again, I think we'll be sending out some resources for that. But there's a list that we can provide of labs that do PFAS blood testing. It's like a pretty extensive spreadsheet that provides like the labs and the cost of the tests. You might also be interested to know that there's a finger prick blood test available that you can do at home. If you don't like getting your blood drawn, that's an option. And we can also provide information about PFAS blood testing in general and for PFAS medical screening guidance for clinicians. So that resource could help if you'd like to talk to your doctor about PFAS, which if you're interested in getting it covered by insurance, going through your doctor is probably the way to go. And there are resources that we can provide that can help kind of guide that conversation on how to approach that with your doctor. But again, yeah, it's not quite the same as like getting tested for lead or something. The research is kind of still very much being in process. So hopefully in the future, it'll be easier to get your blood tested.
Yep. Laurel, you touched on sort of PFAS and soil in an answer to a previous question. We have a question specifically about municipal sludge from wastewater plants being spread on farms and causing major contamination in water supplies, and also livestock too, I believe. Was there an issue in either air or Hyannis with PFAS from sludge?
That is a really great question. And I know Massachusetts Department of Environmental Protection right now is working on approaches to restrict PFAS and sludge and thinking about the best way to handle sludge and minimize exposures to PFAS. I'm not aware of a lot of land application of sludge in either of our communities. Typically, where we might know more about it is on agricultural lands. And I don't think there's a lot of farmland in either of our communities. But PFAS can also, or biosolids can also be used as part of landscaping. And so it's possible that was a source in our two communities. I think because the levels were quite high in the wells and they could be traced back to the firefighting foams, I think that those are the primary sources of exposure, but I think it's often not just one source of exposure. There's also septic systems that can be sources as well. So kind of the whole, because PFAS are in our products, they're in our waste stream. So wastewater treatment plants and septic systems and biosolids and landfills can all be sources really broadly.
Great. So we're nearing the end of our program, and I think we have time just for one more question. Here's one. How do the effects of PFAS on health compare to those of other risk factors, such as diet and lifestyle?
Another good question here. We do know that cumulative exposures to PFAS and other toxic chemicals add up. The timing and the extent of these exposures matter as well. And of course, we know that diet and lifestyle factors are also really important for determining health. So it's hard to say which one is more important or which one is larger. I think it's important for people to have a healthy lifestyle and at the same time to take steps to reduce exposures to toxic chemicals where we can. I think overall, we think that people have a right to expect that their food and water and products in their homes won't contain chemicals that can affect their health.
Great. Well, I'm afraid I'm going to have to stop here. Thank you everyone for submitting all those great questions. I'm sorry we didn't get to all of them in the program, but I'm going to pass it back over to Beth, who's going to wrap things up for us.
Great, thank you, Alex. And thank you, Laurel and Emily and all of you. This has been a fascinating educational discussion. If you have a question that didn't get answered, please email Quinn Fay, Assistant Director of Development at fay@silenspring.org, and she'll get back to you. We'll also be emailing you a link to the recording when it's available, so keep an eye out for that. And again, I just want to remind everyone that Silent Spring's work on PFAS depends on generous individuals, and support for this critical work is needed now more than ever. So if you'd like to learn more about getting involved in the organization, please reach out to Quinn again at fay@silenspring.org. And thank you again for joining us, and have a wonderful rest of your day.